talking about the end of life is not a topic that, we normally bring up at the dinner table. However, we do have to think about it. And, have you ever wondered what the difference is between palliative care and hospice? Those are two completely different types of services, yet related. So tonight we're going to go ahead and just talk about, planning for end of life. Again, not the most wonderful topic to bring up, but something that we all need to think about, because the bottom line is if we don't make plans and make our wishes known, then it could very well end up that a stranger is going to make decisions for us, and nobody wants that. So, hi, I am Pam Dunwald, one of your nurse advocates from Your Nurse Advocates Consulting, and this is Tuesday Tips. We're coming live from inside our private Facebook group, speaking out on the care of your aging parents. So we're glad you're here and welcome. So let's go ahead and jump right in. As in my role as a patient advocate, many people come to me confused, overwhelmed, when they're thinking about the process of end of life. And I totally get that. Being a home health and hospice nurse for a long time, I've certainly been part of that process with so many families and knowing what they go through. But we're going to focus a little bit tonight on the difference between palliative care and hospice. So, I'm hoping out of this session with us today that we're going to be able to help you make the right decision, when it comes to end of life care options, which might be an appropriate service to start with. But, no matter what stage you're at, whether you're, planning for later in life, or, you're facing, entering that final journey, taking that final path, understanding the importance and the differences between palliative care and hospice can be really an invaluable tool in helping you to make, the best choice for either for yourself or a loved one. So how does palliative care and differ from hospice? It can cause a lot of confusion. And so let's talk just 1 second before we get into the differences. Let's just touch base a little bit on advanced planning. Advanced planning is any time that you have a chronic illness, or even if not, it's a good time to just kind of take stock of what's going on and look to that future and see how you would like that healthcare journey to go. So right away, everybody should have advanced directives. That's advanced directives, living will, healthcare power of attorney, so all similar documents, making legally your wishes known, appointing someone to be able to make decisions for you in case you can't make them. For example, God forbid someone has a stroke tomorrow or tonight and they go into the hospital and they're unconscious. If they don't have these advanced directives in place, then that puts a dilemma with, the doctors and the social workers and the staff at the hospital, because they don't know who is going to make those wishes for you. Now, they certainly will try and involve family. Even if you don't have advanced directives, they're going to look to family. But the challenge comes in is when your families can't agree on your care. They may have a difference of opinion, and it may not be what you want, but they may think that they know best. So if there's like a stalemate with the family and what to do, then oftentimes a social worker will have to contact the county, the court system, and look at putting, having a guardianship hearing, so emergency hearing, so that these decisions someone's going to make these decisions for you, and it may not be a family member. So, all right, so let's get into, now that we know that, we need to have advanced directives, will make sure you're having these discussions with your family members, talking about what your preference is for a funeral home. And again, don't leave these types of decisions to people that you may not want to have that say so. All right, so palliative care is a type of medical care that focuses on relieving symptoms and providing comfort to people with chronic illnesses or terminal illnesses that maybe people are continuing to want to treat. So palliative care is treated, it's covered under Medicare, and you'd have to get, as far as if you have insurance or Medicare Advantage plan, you'd have to see, they would have to get prior authorization to see if the service would be covered. but it is covered like a doctor's visit. And so it is covered under the Part B, or the outpatient part of Medicare. If you have a copay to go to the doctor's office, you would have a copay every time you would have a palliative care visit. Now, palliative care, depending on where you live in the country and the type of palliative care services in your area, palliative care can be, the visit can be one of two places. You can either go to the palliative care appointment at a doctor's office, so you're going to the clinic and meeting with a palliative care provider, or some palliative care companies, independent companies, will have nurse practitioners that actually go into the home. And this is a really good option for people that it's not easy for them to get out to go to the doctor's office anymore. So you would have, a provider. Oftentimes it's a nurse practitioner that will come to the home. They come once a month, once every 2 to 3 months, depending on where you are with that chronic illness. Say you have end stage congestive heart failure, or COPD, chronic obstructive lung disease, or any other form of a chronic Parkinson's, any form of a chronic disease that we know there isn't a cure for, but maybe you're not so far into the disease process that you're not looking right at end of life, but you're looking to preserve the quality of life that you can. So you want to manage symptoms, and so palliative care is a way to stay on top of that and increase the quality of your life by managing those symptoms. So that's what palliative care is. Palliative care, there's no aides that come in. No one's going to come and give you a bath. Again, you'd have someone either come to the home, or you'd have to go to their office to meet with them. Could be once a month, once every 2 months, once every 3 months, somewhere in that range, depending on where you are in your illness. Now, hospice services, on the other hand, let's take a step back. With palliative care, you can continue, if you have cancer and you're continuing chemotherapy, you're continuing radiation, you're continuing treatment, you can be on palliative care. So that is another important differentiation to make very clear when we're looking at palliative care versus hospice. So hospice is for end-of-life cares. The doctor would say that they would not be surprised if you passed in 6 months or less. As a hospice nurse, I've had patients on hospice more than a year. With hospice, you can graduate. And what I mean by that is some people, they get on hospice and their symptoms are managed so well, they actually start to get better and they come off hospice, could for a period of time before they have to go back on. So you can graduate from hospice, or you can choose to stop your hospice benefits. Once you elect to choose hospice, that doesn't mean that you're stuck there. You can say, okay, I want to end my hospice benefits, and you can do that. So now hospice, the difference between hospice and palliative care as far as payment goes is hospice is covered under Medicare Part A, which is the hospitalization part of it. So hospice comes with a lot more services and a lot more benefits. So for example, you would have home equipment, hospital bed, oxygen, wheelchair. You would have hospital equipment paid for, medications related to your terminal illness of the illness that you have that brought you to hospice. Those medications are all covered. You have a nurse that comes once a week. You have a social worker that comes every couple of weeks. You can have access to a chaplain. This is where you can have a home health aide come once or twice a week and help you with bathing and things and personal cares. Besides those regular services, some hospices have other services such as music therapy or massage therapists that they can provide some of these extra services. And these would all be included under the hospice, which is the Medicare Part A. So difference in services and difference in how they're paid for. Both palliative care and hospice have social workers. They provide emotional support, psychological support, and also symptom relief and promote quality of life. So those are the similarities between palliative care and hospice. Okay, we talked a little bit about the difference between hospice and palliative care. We've talked about how palliative care focuses on reducing symptoms and improving quality of life at any stage of illness, where hospice is more towards end-of-life cares. So we talked about how it's paid for. We discussed the type of services that are offered. We talked about symptom management, counseling, respite care. Let's talk a little bit about respite care. So when you are in hospice and you're receiving your hospice services at home, and you may be a family caregiver and you may be really struggling, this is a very emotional time and it's not easy. I don't care any way you slice it or dice it, no matter what anybody says to you, this is a very, very difficult time, and it is truly a labor of love and not easy. So if you need a break, hospice can provide a respite, and that is, again, included in your hospice services, where depending on your hospice, some hospices have hospice houses where you can even be a resident in a hospice house. Now, residential care is not paid for under the hospice benefit. So if you're going to live at a hospice facility, the room and board is not covered, and that would be paid separately, oftentimes private pay, and that you would work out with the hospice agency. But if they do have a hospice residential facility, a lot of times you can go there. Your loved one can go there for a week at a time and give you that break. With palliative care, they can arrange for a respite stay for you, but most likely it may be in either an assisted living, a nursing home, or the hospital. Obviously, the hospital would be, and respite is usually private pay, so the hospital respite stay would probably be the most expensive, and then your nursing home and then your assisted living would be probably a little bit more affordable for a respite stay. But all of those types of facilities do accept respite patients. And that's one of the things as nurse advocates, what we do is if we're working with a client that is dealing with those end of life cares, we help them search out and find the hospice that's appropriate, especially if they're looking for one that may need, that has a residential facility, or palliative care. Will help them look at the different palliative care agencies and see which ones do come to the home versus having to go to so these are a lot of things that we can help you and come alongside you and help put these plans in place. So we're making sure that your wishes and your desires and your goals for your treatment, for your healthcare, and for those healthcare journey is honored, and we find the appropriate services to match your needs. So an example where either approach would be effective. So say, for example, you have a chronic lung disease, and you're on oxygen, but you're doing fairly well. I mean, you're still able to get out and about. You bring your portable oxygen with you, or you have your oxygen concentrator at home. You still have a good, fairly good quality of life. You can, you may not be able to ambulate or walk distances like you used to. You may have to take breaks going from one end of the home to the other, but you feel that you're still there's still a lot of quality of life. Well, then palliative care would be maybe appropriate for that to help manage those symptoms. And one thing that palliative care is very good, a lot of hospice companies can offer palliative care. So when the time comes to have to make that transition or choose to make that transition from palliative care to hospice, it's an easy transition because it's the same caregivers, it's the same company. So the change is not difficult. It's a very smooth change and a smooth transition. So what are potential drawbacks for each option? Well, palliative care, the drawback for palliative care is you don't get all the supportive services and the services paid for as you do with hospice. So again, you will have a copay for every visit, and their visits are not as frequent as hospice. It's more infrequent. The drawbacks to hospice, the biggest drawback is you have to come to the reconciliation that you're not going to seek active treatment anymore. So you would not be actively getting chemotherapy, or you would not be continuing to get dialysis. And so for renal failure. So that is the drawback with hospice, is you do have to be in a place where you're choosing quality over quantity, rather than to do everything we can to keep you with us. And here you're saying that, I would rather have a shorter life of more quality than a longer life that maybe I'm suffering more. So those are kind of the drawbacks of each of palliative care and hospice. So the process of getting started for either one of the options needs to go through your doctor, the social worker at the clinic. It should start with your doctor. When you have a doctor appointment or you ask to see the doctor, ask the doctor if they feel that palliative care would be an appropriate service. Both hospice and palliative care needs a doctor's order, which means your primary care physician needs to give them their blessing, write an order, say, yes, I do feel that palliative care or hospice would be appropriate. That's the first place to start. And then once the physician has felt that that's the appropriate service, then the social worker at the clinic, a nurse advocate like Linda and myself, the social worker at the hospital, any of those types of resources could help you choose and select a palliative care or a hospice agency that may meet your needs. And so, these are not easy conversations to have with your doctor too, but that's where we need to start, because the doctor is going to know your situation and your chronic condition best, and can best have that conversation with you to see which service would be the most appropriate. So how do you choose between palliative care and hospice? And I'm going to say you need to think about what matters most to you. And the easiest way to say that is quantity of life over quality of life. And you want to consider your comfort goals, your finances. These are all things that need to be taken into consideration. And that's one of the things that we discuss with our clients as well, is we look through, their lifestyle. What do they want? Where are their family? Are they alone? Do they have long distance family? What is their budget? What are their finances? And so all of these come into play also as far as what might be the appropriate service. So in wrapping up, I just want to say that, this is a difficult situation. And again, it's not something that we like to talk about, but, my kids and I have had this conversation. They don't like to talk about it, but they know we need to talk about it. And they want me to have everything in place that I can, because my daughter said to me, she says, Mom, she says, I'm not worried about having to care for you. I'm not worried about any of the things that I need to do. But what I am worried about is making the wrong decision. I'm worried about making the wrong decision, or making a decision that you wouldn't want, or that I'm not sure about. So please have these things ready for us. I have 4 kids, and, they say, Mom, please have those things ready for us so that we know what you want. And it's, we're not going to have to worry about, making that wrong decision. So have the open discussion with your family. I know the holidays are coming. A lot of families going to be around, and I know this isn't a topic that we would want to bring up during the holidays, but it may be one of those times where you have your whole family together and try and find a way to have an open discussion. So just want to say thank you for stopping by. I don't see that we have any questions right at the moment. So we will see you next time for Tuesday Tips. Take care.